This is the story of the unexpected breech birth experienced by Sarah and her partner Luke. Sarah is a G3P2. She's 39 plus 4 weeks gestation and her baby's estimated due date is the 27th of October 2016. Sarah's blood group is O negative. Her pregnancy has been normal and low risk throughout. All her bloods and ultrasound screening assessments are normal, including her 20-week morphology scan, her STI infection status and her GTT tests. Sarah has been in shared care for this pregnancy with her GP and the local public hospital. Sarah was advised throughout this pregnancy to go to hospital as soon as she began contracting or if her membrane spontaneously ruptured. Because of her shortening length of each previous labour and birth, this one was expected to be faster. Sarah began contracting this evening at 8:30 and she and Luke had to wait for her mum to arrive to look after the kids before they could leave, so they didn't end up getting to the hospital until 10:30 at night. Upon arrival in birth suite, Sarah is assigned to the midwife Brooke. And as they enter the room, Sarah tells Brooke that she's feeling the urge to push. With her next contraction, Sarah's membrane spontaneously ruptured as the midwife noticed very fresh meconium liquor on the pad and also on Sarah's legs. As Sarah leaned over the edge of the bed, having another contraction, Brooke wiped down Sarah's legs from behind and took the opportunity to have a look at the introitus, and she immediately saw a bottom-on view.
So Sarah, I've noticed that your baby's in the breech position, which is not the normal way that babies come out, but I'm still really confident that you'll be able to have your baby vaginally.
Yep.
Okay, so what I'm going to need you to do is hop back up on the bed, on your back, if that's okay.
Yep, it's fine. Oh, I think I'm having another contraction.
Okay, so get through this contraction. You can come here. That's it, good job.
Oh.
Sarah is a little overwhelmed with how quickly her labour is progressing and is now a little anxious too about birthing a breech baby. She seeks reassurance from Brooke as she changes position and moves onto the bed. Luke moves to her side, holding her hand and encouraging her through each contraction.
Is there something wrong with my baby? Is everything going to be okay? How's it going to come out bottom first?
So everything's okay at the moment. You're doing an amazing job, and I know these contractions are really painful, but it is a frank breech position, which means that the hips are flexed and the legs are extended. So your baby's bottom is a similar size to its head, so remember it always fits the other way as well. So all you need to do now is just keep breathing through your contractions and focus on the fact that you're going to meet your baby very, very soon. So right now, I'm going to press the call button to get another midwife in here, and there's going to be a little extra help in here, okay?
Yeah, no worries.
So I'm just going to pop a CTG monitor on you to check baby's heart rate and to make sure that everything's okay. Is that all right?
Yeah, that's fine.
Breech birth occurs in approximately 3.8% of all women, and a skilled clinician with supporting resources can help a woman to have a vaginal breech birth. Brooke presses the bell, calling the second midwife, Ness, into the room and returns her attention back to Sarah, who has had a little bit of space between the intensity of her contractions.
Sarah, just while we wait for the other midwife, I'm going to get some things ready so we can have your baby.
That would be amazing. This is all a bit intense and painful, and I just want my baby out already. Can I have some gas, please?
Yeah, I'll get that set up for you.
Thank you.
In a very short space of time, Brooke gets the nitrous oxide set up for Sarah. She also gets a birth bundle, a breech cloth, sterile gloves, apron, safety glasses and some extra blueies out of the storage room and places them on the trolley. As Brooke is returning to Sarah and Luke, Ness, the second midwife, enters the birth suite.
It's just Ness.
Come in.
Hi.
Hi, Ness.
Hi.
Luke and Sarah, this is Ness.
Hi,
She's
how
going
are
to
you?
help us out today. She's going to be in the room until we meet your little baby. So Ness, I'll give you the notes, but Sarah and Luke's baby's decided to come out breech.
Oh, okay, a breech birth.
Yeah, so can you just call a code pink and
Yeah.
let the midwife in charge know, please?
Yeah, certainly. You guys are in really good hands. Brooke is really experienced with breech delivery, so you'd be absolutely fine. I'll go and let the midwife in charge know, and then I'll check your resuscitator, and I'll do the scribing for you as
Oh,
well.
beautiful.
Yeah.
Thanks, Ness.
Okay.
Thank you. Ness has gone out to let some other staff know, so we're going to have an obstetrician and a paediatrician in the room when you birth your baby. but it's all precautionary. So when baby comes out, we're expecting it to be nice and healthy, and if that's the case, then they won't be in the room for very long. So it's important just to stay concentrated on what I'm saying, and we'll have a happy, healthy little baby at the end of it.
Sounds good.
So I know this wasn't your birth preference, but we've all been a little bit surprised with the way that your baby's presenting. Have you got any questions that you want to ask me?
Is it alright if I can just stay in this position because the gas is helping and I just feel really comfortable as the contractions are coming on top of each other now?
We're happy with whatever needs to happen to make sure the baby's okay.
Okay, so you can stay in that position, that's absolutely fine. And Luke, you're doing a great job as well. It's really important that we're really supportive of Sarah so we can have a nice, happy, healthy little baby.
So Ness returns to the room and begins to methodically check the resuscitaire and emergency equipment in preparation for the birth. This includes checking the heat, lighting, air, oxygen and suction. The golden rule for breech birth is hands off the breech. However, midwives should also be experienced and skilled in performing the specific set of breech birth manoeuvres if a baby does not spontaneously birth itself.
So Sarah, we just need to let your baby do a little bit more work to move its way down, just as if the head was crowning. Okay, let your contractions do the work. Try not to do too much active pushing, and I'll let you know when it's okay to push. Is that all right?
No worries, I'll try.
You're doing an amazing job, honey. I'm so proud of you. We're going to see our baby soon.
Okay, Sarah, I can see that the bottom is beginning to crown at the perineum now. If you need to push with the next contraction, you can.
Oh my god, it's taken so long. Is the baby out yet?
Okay, Sarah, I can see that the bottom is beginning to crown at the perineum now. If you feel like you need to push with the next contraction, you can. We're getting there, Sarah. I can see that baby's feet are in the most common position, up around its ears. I'm going to help your baby's legs to be born first, and I just need to flex its legs to do that. Is that okay?
Yeah.
Sarah, both of your baby's legs have now been born. You're doing so well. We just need to wait for the body to be birthed now. Sarah, you're nearly there. Your baby's whole body is out and it's in a really good position. When you're ready with the next contraction, have another push. Sarah, your baby's arms aren't coming out yet, so I'm just going to help it. Is that okay?
Yep.
Brooke firstly places a breech cloth over the baby to ensure her hand positioning doesn't slip. She then wraps her fingers around the baby's thighs with her thumbs on the baby's sacrum, which will prevent her hands edging up and possibly damaging the baby's internal organs. She then performs the Loveseps manoeuvre by turning the baby 90 degrees into the transverse. She reaches over the baby's shoulder and slips a finger down into the brachial plexus, sweeping the arm down in front of the baby's body. This releases the anterior arm. She completes the manoeuvre by doing the same on the other side so that both arms are now free.
Okay, Sarah, your baby is nearly born. All that has to happen is the head needs to be birthed.
Oh, that's such a relief. I see my baby.
Of course, Sarah. I can show you your baby using a mirror if you like.
That'll
Yeah?
be great.
Do you want to have a look as well, Luke?
Okay, good.
Can you see?
Oh, that's our baby.
Oh my
Not long to go.
Now the baby's legs, arms and body have been born. The midwife is now hands off the breech once again to ensure the nape of the baby's neck is visible before performing the next manoeuvre. To successfully complete the breech birth of Sarah's baby, Brooke performs the Morrow Smelly Viet manoeuvre to aid flexion and give control to the birth of the baby's head. She lays the baby along her forearm and gently inserts 2 fingers inside the vaginal outlet until she can feel that she has her 4 and middle fingers placed on the baby's maxillae bones. With her non-dominant hand, Brooke applies gentle pressure to the occiput at the nape of the neck, which facilitates flexion of the head to birth in an arc and into the warm, sterile towel that the receiving midwife has. The alternative manoeuvre to this is the Burns-Marshall manoeuvre, where the midwife grasps the baby's ankles with 4 fingers and brings baby up through a 180-degree arc and the perineum needs to be guarded to prevent the sudden birth of the head.
Congratulations.
It's a girl.
You did well. It's a girl. It's our girl.
The definitions of the two types of third stage. Physiological third stage, which is when a woman relies on her own production of oxytocin, which is the natural hormone produced during labour and birth. This helps her birth her placenta. Or there's active management. This is when the midwife gives an injection of a drug, either syntocinon or sintometrine, at the top of the woman's thigh soon after the birth of the baby, which helps the placenta detach from the wall of the uterus. After the baby's umbilical cord has been clamped and cut, the midwife will perform controlled cord traction.
Okay, Sarah, so it's time to give you the injection that we spoke about before to help with the birth of your placenta. Is that okay?
Yeah, that's fine.
Great.
Brooke and Ness check the 6 rites of administration before giving Sarah the injection. They need to ensure that they have the right patient, the right drug, the right dose, the right route, the right time, the right documentation. Ness administers the syntocinon injection to the thigh while Brooke begins to look for signs of placental separation. These include the fundus rising up and becoming more globular, that there is a gush of blood, and that the umbilical cord lengthens at the vulva.
Just going to check your baby's heartbeat. Great. So Brooke, the baby's APGARs are great. 8 at 1 minute. She has good reflexes. Arms and legs both good. Pulse is 110 beats per minute. She's reacting to tactile stimulation. She's got a pink torso and blue extremities, and as you can hear, she's crying quite loudly. You and your baby have worked so hard. Congratulations. Good job, guys. Now it's time for a cuddle. Okay. I'm just going to check your baby's heartbeat again. Yep. Great. So Brooke, the APGARs at 5 minutes are 9. So I'm just going to scribe that in the neonatal chart.
Thank you so much, Brooke and Ness. I couldn't have done this without you.
Absolutely. I was a bit freaked out, but now look at her and baby. I'm so glad.
Not a problem at all. It was our pleasure.
You're very welcome. Well done.
Thank you.
The placenta is set aside for assessment. Brooke assesses Sarah for any vaginal or perineal trauma. Estimated blood loss is calculated. After gaining parental consent, Brooke will administer the intramuscular vitamin K and hepatitis B injections respectively into the baby's left and right anterior thigh. And finally, to complete the birth, Brooke, as the accoucheur midwife, completes all the paperwork prior to transferring Sarah, Luke and their new beautiful baby up to the postnatal ward.
Hi Sarah, hi Luke. Good to see you again.
Nice to see you again.
You both look great. Well, the 3 of you do actually.
Thank you.
How's she going?
She's doing really well. We named her Rosie.
Oh, Rosie.
Oh,
How
Rosie.
beautiful.
That's a great name.
So I know that the birth wasn't exactly what you planned or what we expected really. So we just wanted to come and see how you all were and if there were any questions you wanted to ask and just to have a little chat about how it all went.
Geez, I don't know.
As her partner and husband, and I feel it was quite traumatic for me, or witnessing she's giving birth to a baby who's breech. But we're all glad, you two were there and helping us out, and then we had such a healthy baby in the end. So yeah, I'm really glad. Thank you so much.
Oh, you're welcome. And because you've already had 2 babies, that it must have been difficult to see it come out a totally different way.
Yeah, no, it was quite difficult to see, but yeah.
Just wanted to be a little bit different, didn't you, Rosie?
She's done a good job.
Thanks. No, but she's doing well. She's breastfeeding fine. Can't wait to go home and start it,
Start family of 5. Beautiful. Well, it was so lovely to look after you both.
Yeah, it was a
And
pleasure.
little Rosie. All the best.
Thank you.
Thank you.
Take care, guys.